Gerard, Cellzome. Hot cells, mapping proteome-wide drug Bindin.
I work for Cellzome up on the hill at the EMBL campus, a biotech company which actually in 2012 was acquired by GSK, so we're big pharma now, but we continue our work. Next slide, please. The biggest problem in drug development is attrition, which basically means that 90% of all the money is on failed projects, and you need to start about 20 projects for one to make it through the finish line. Next slide, please. We read more about failure, in fact, than about success, and failure in the clinics can cost hundreds of millions. In this case, actually, the drug failed because the drug didn't engage its intended target, which is actually more often the case than you would think. The next slide, please. This has led many in the pharmaceutical industry to follow the 3 pillars concept of drug development, in which the first pillar states the drug must get to the cell or tissue of action. The second pillar states once there, it must engage its target. And the third pillar states it must elicit the appropriate pharmacological response, ideally without side effects, so without off-targets. The next slide, please. So for us, the million-dollar question was, how can we make sure that our drugs at GSK get to the target cells, engage their proper targets, but do actually not at the same time bind to off-targets, which then give a liability for side effects. Next slide. We developed a technology based on a very simple experiment. All of you have done this experiment in the morning, typically, where you take a cell, in this case it's an egg, and you heat it, proteins denature and aggregate. This is the basis of the technology that we developed to measure target engagement. Next slide. Interestingly, a protein, when it is bound to a drug, denatures and aggregates a little bit later at a little bit of a higher temperature. So when you look at proteins in a cell, treated or not treated with drug, you get this little shift in the denaturation curves. This was an observation made by Per Nordlund a few years ago. Next slide, please. But Per, being an individual biochemist, looked for one protein at a time, which is tedious because the cell contains many thousand proteins, so many possible off-targets. We, being proteomics people, can analyze 10,000 proteins all at once, can quantify them, and can study drug binding by just heating our cells up. Next slide, please. For this technology, which we call thermal proteome profiling, we got the Signan Breakthrough Prize of the Year by Science, which was nice. Next slide, please. We go further, and then one slide. One interesting first set of results was on kinase inhibitors, which we have heard about today. Many of these kinase inhibitors we found by a new technology actually act on enzymes in the heme synthesis pathway. These enzymes are not kinases, and therefore the finding was unexpected. And this leads to an accumulation of heme pre-products, protoporphyrins in the skin, and gives often rise to this sort of extreme sunburns, which we now can prevent by running this.